Prostate cancer is the most frequent cancer in men in the United States. It usually has few early symptoms and grows slowly. Welcome to Medical Made Easy. In this video, we are going to discuss when to begin screening. Is it wise to get one? What to expect? How to prepare? Results, frequently asked questions, and conclusion. Doctors can do tests called cancer screenings to identify cancer early on, before symptoms appear or the disease progresses. Prostate exams are performed by doctors to check for irregularities. The fluid that contains sperm, known as semen, is secreted by the prostate gland. The prostate is situated in front of the rectum, directly beneath the bladder. The center of the prostate gland is where the urethra exits the bladder. Men's prostates can expand with age and begin to cause problems such as prostate cancer. Prostate cancer is the most frequent cancer in men in the United States. It usually has few early symptoms and grows slowly. When should men have a prostate exam performed? Prostate cancer can be detected early with the aid of a prostate screening, but you will need to consider the advantages of the test against their risks. Talk to your physician about prostate cancer screenings. The U.S. Preventive Services Task Force now advises males between the ages of 55 and 69 to discuss with their doctor before determining whether or not to have a prostate-specific antigen screening test. It advises against screening males who are 70 years of age or older. No one should be screened without first discussing the uncertainties, risks, and potential benefits of prostate cancer screening, according to the American Cancer Society. The Prostate Cancer Foundation advises men to engage in precision screening and work with their physician to develop a personalized prostate cancer screening regimen. The right time to have this talk will depend on a man's age and other risk factors that could raise his chance of developing prostate cancer. The general suggestions are as follows. Men over 40 who are dark-skinned have known genetic abnormalities that may raise their risk of cancer, such as the BRCA1 or BRCA2 mutation, or have a family history of prostate cancer or both cancers in a first-degree relative. Men over 45 who don't have any established risk factors, based on factors like life expectancy, pre-existing conditions, family history, and ethnicity. PSA screening should be carefully examined. Certain treatments have side effects that can reduce life expectancy and quality of life. If you experience symptoms of a prostate condition, such as painful or frequent urination or blood in your urine, talk to your doctor about getting a prostate exam. The American Cancer Society advises obtaining a prostate-specific antigen blood test if you choose to get a prostate cancer screening following this discussion. An additional component of your screening could be a digital rectal exam, DRE. Additional screenings. Your health, age, and PSA levels will determine what to do if your DRE results are normal. The interval between follow-up screenings in the event that a routine screening yields no suspicious results for prostate cancer is determined by the PSA blood test results. These suggestions are offered by the American Cancer Society. A retest may not be necessary for men whose PSA is less than 2.5 nanograms per ml every 2 years. Annual screenings for men with a PSA level of 2.5 nanogram per ml or above are recommended. Is it time for a prostate exam? Before making any decisions, men should carefully weigh the benefits and drawbacks of prostate examinations with their physician, according to the American Cancer Society. This is due to the advantages and hazards of prostate cancer screenings. For males 70 years of age and older, the advice is against prostate cancer screening using blood tests due to potential hazards such as overdiagnosis. As with any test, though, make sure this is the right one for you by talking to your doctor. Certain cancers can be treated more easily and prognostically if they are discovered early. Getting ready for the prostate exam. You don't need to take any extra steps to get ready for a prostate test. If you have hemorrhoids or anal fissures, let your doctor know because a DRE may make them worse. If you have a history of dizziness, let the person taking your blood know. Your doctor may recommend a blood test if you have a prostate cancer screening. Before doing a cancer test, your physician could ask for your signature on a consent form. What to anticipate from the test? Prostate exams are quick and simple to obtain at your doctor's office. Typically, a straightforward blood test will be performed by a doctor to screen for prostate cancer. PSA blood test. The PSA level is expressed in nanograms per milliliter by this blood test. An increased risk of prostate cancer is indicated by higher PSA readings. A tiny volume of blood is drawn from an arm, vein, and utilized to calculate the PSA. Digital rectal exam is another procedure that your doctor can decide to do. Your doctor will ask you to undress from the waist down and change into a gown before beginning this examination. Your doctor will ask you to lie on the exam table in a fetal posture, with your knees to your chest or bent over at the waist in order to do a DRA. A gloved and lubricated finger will then be inserted into your rectum. Your physician will feel for any lumps or soft or hard spots that could point to a concern. It's possible for your doctor to detect an enlargement of your prostate. A DRE isn't extremely painful, but it can be comfortable. Particularly if you have hemorrhoids, it will only take a few minutes to complete. Results: what occurs when PSA is elevated? An increased PSA level might be indicative of benign prostatic hyperplasia or prostate infections, in addition to prostate cancer. Numerous factors including age, prostate gland size, infection, and more can raise PSA readings. Your doctor can suggest a follow-up PSA test to validate the result if your PSA is high, as well as periodic PSA testing and DRE exams to monitor the situation over time. Should PSA keep raising, your physician may suggest more imaging and testing. Unusual DRE. One technique that your doctor can use to identify a number of prostate and rectal issues is a DRE, digital rectal examination. These issues include abnormal lumps in your rectum and anus, BPH, prostate cancer. Your physician can quickly determine whether there are any regions that need more testing, because they may be concerning. DRE results might be normal or abnormal, but in order to diagnose prostate cancer, medical professionals usually use a combination of tests. If your doctor has not already suggested a PSA blood test, they might do so if they detect anything unusual during the DRE. Your doctor may suggest further testing if your PSA levels are high and your DRE is abnormal. These tests could include MRI scan, transrectal ultrasonography, prostate biopsies. Frequently asked questions. Prior to a prostate exam, should I urinate? Before a prostate exam, you do not have to adjust your toilet habits or poop. You are free to use the restroom if you absolutely must, or if doing so will help you feel more at ease before the test. Is a prostate exam painful? While an exam for the prostate may cause discomfort, it is not to be unpleasant. And any discomfort felt after the test should not linger long. Urge to urinate or momentary pain are possible. Might I examine my own prostate? It is not advised that you attempt to examine your own prostate. Because the prostate is an internal gland, self-examination can be dangerous. The exam should be conducted by a licensed healthcare provider for your protection. A professional will also be better equipped to determine whether there is a cause for worry. Conclusion. So, start talking to your doctor about prostate cancer screening is a good idea starting at age 40. If you have a family history of cancer, are dark-skinned, or have known genetic abnormalities, at age 45, talk to your doctor about testing even if there is no known dangers. Your doctor's office will conduct the examination, which usually include a straightforward blood test. A digital rectal examination may be conducted if required. The course of action will be discussed with your physician if one or both of your prostate cancer screening tests reveal abnormalities. I hope you liked today's video and it was informative for you. If you did, please do not forget to hit the thumbs up. Also, do not forget to subscribe to my channel for more informative content. Until next time, stay healthy, stay happy. Bye-bye.